COVID-19 pandemic has had a huge impact on mental health, and especially in children and adolescents. And we are delighted to have Dr. Dan Marullo and Amy Brown with us today to discuss the current state of mental health, particularly for young people. They will provide insight into common diagnoses and talk about how those who've been impacted during the pandemic, as well as some of the protective factors that promote resilience. And we'll also look at how art therapy in particular can assist with the improvement of mood and coping skills and decrease symptoms of common mental health challenges. So at this point, I will turn it over to Dr. Dan Marullo. Thank you. Dr. Marullo, you're on mute.
Sorry about that. I'm going to share my screen now. Hopefully you can see that. Perfect. Okay. Well, again, thank you for having us. I'm Dan Marullo. I'm a psychologist here at Children's of Alabama. And, I've been asked to talk a little bit about kind of where we are in terms of mental health with our kids. And this may sound a little doom and gloom. Hopefully not. But we do have some challenges. Oops. There we go. That's better. To face. So, Amy and I will be talking about mental health issues and some ways we can address that. I'm also listed here as our colleague, Dr. Nina Reynolds. Dr. Reynolds and I put a lot of talks together. We're kind of like Lennon and McCartney. We just kind of go back and forth a little bit. So even though she's not with us today, she's with us in spirit. Nothing to disclose, at least on my end. I get paid by Children's. I thank them every 2 weeks. So we're good there. So as you probably have heard, the Surgeon General of the United States recently made a statement that we are in a mental health crisis in our country. I would say that we have been in a mental health crisis in our country that predates the pandemic, and I'll give you some data to look at that as well as what's happening with the pandemic. But before we do that, let's think about, our kids, all of our kids, whether they have diagnosable mental health issues or not. All of our kids are stressed, and there's lots of different reasons for that, okay? And stress, by the way, is neither good nor bad. It simply is. It's how you define it. It's some of the things that our kids are exposed to and are stressed by are what I call the typical bumps and bruises of life. As you can see from this list, dealing with friends at school. Well, a lot of kids have issues dealing with kids at school from time to time. It's not necessarily an abnormal thing. That's part of the development of childhood, is learning how to interact with your peers and how to negotiate conflict and all that. Now, some kids may have more difficulty than others, but again, a bump and bruise of life. So some of the things that our kids are experiencing are what you'd expect just from living, just from being a human being. Some of our kids have more challenges, and it certainly puts them at a little bit higher risk for difficulties. For example, kids that live in impoverished circumstances, whether they have food insecurity or housing insecurity. Maybe their school's not one of the better schools, that kind of thing. So there's certainly some things that are beyond the normal bumps and bruises of life that could certainly put a child at a little bit higher risk. We also have to factor in that our modern culture promotes a lot of issues that may be stressful for our kids. Just our kids are developing faster physically as well as emotionally. There's a lot more expectations. When I was a kid, and if I played Little League Baseball, it was rec league. Now there's travel teams. It's not enough just to be a good student. Now we've got multiple AP classes and all these other things. Not necessarily bad, but again, added pressures. We have to pay attention to media. We're learning more and more about just the effects of multiple access to media on our kids in terms of exposure from the very youngest ages, infants and toddlers being exposed to media in lots of different ways, all the way up to our teenagers. Certainly issues like bullying and teasing, age-old problem, which gets compounded again by modern technology, right? Before you could get away from the bully, you would go home. Now you can't because it's online. All those sorts of things, and certainly anything that's happening to the family affects kids. Parents who are experiencing job insecurity. Certainly, it's something we've seen a lot over the past couple of years. Anything that affects the family certainly affects kids. So, and then we've got the pandemic. So the issues around the pandemic, and really when you think about the effects of the pandemic on kids, you've actually got a couple different groups. One group are children who did not get exposed to COVID virus, right? So they're COVID negative, they haven't been exposed to the virus, but they're exposed to all the social issues that are going on around the virus. So for missing school, going virtual, going to virtual school, the added stresses at home, maybe again parents losing jobs or being furloughed, or a parent that becomes sick and certainly worried. You see that a lot. We saw that a lot with healthcare workers. Kids experiencing a lot of distress because their parents were healthcare workers or first line responders during the pandemic. All those things affect a child's routine. And when we think about children, we put them in a developmental context. We think about, wow, what are the challenges, the normal, natural challenges of growing up? And one of the things that really was affected was kids lost out on those natural opportunities to engage with peers, engage with family, engage in those normal developmental activities, from little bitty, being able to go to preschool and interacting with other kids for the first time, all the way up to our teenagers that missed out on prom, missed out on homecoming. Those things that, as parents, we go like, yeah, what's the big deal? But it's a big developmental milestone. It's just one of those touchstones. So, all that aside, let's just think a little bit about when we talk about our kids experiencing much more distress. What are we talking about? So I'm going to focus on depression and anxiety. Okay, we're going to kind of forget about ADHD and some of those other disorders, because from a clinical standpoint, that means something very different than somebody who's not in the mental health field. So when psychologists, counselors, therapists, psychiatrists talk about depression, we're talking about this broad statement right here, that the presence of sad, empty, irritable mood accompanied by somatic and cognitive changes that affect an individual's ability to function. I highlighted somatic and cognitive because depression and anxiety isn't just emotional, isn't just feelings and all that. It's also physical. And I see a lot of this in the hospital in my work, where kids who are experiencing a lot of distress, whether it reaches a level of depression or anxiety, or having a lot of physical symptoms, stomach, things that look like seizures, all sorts of things. So it's not just cognitive, emotional, it's also physical. And with anxiety, it's features of excessive fear and anxiety, a lot of worry that goes on. So those are very broad. Now, when we talk about these things, first of all, everybody's entitled to a bad day, okay? You can have your child, because I know there's parents out there going like, oh my God, my child's going to have, when we start going through symptoms, my child's going to have to tick off all these boxes. They're fine, okay? Everybody's allowed to have a bad day. What we start getting concerned about is if there is a change in behavior and it's persistent and it's starting to affect daily functioning, okay? It is not unusual for a child, a teen, an adult to experience something that is stressful in their life and for a short period of time to have some sort of an emotional reaction to that. That's not, doesn't necessarily rise to the level of psychopathology. Okay, it's a normal reaction. So in order for us to really become concerned, well, I shouldn't say be concerned, we should always be concerned. In order for us to reach the level of clinical concern, persistent change in functioning. Okay? We also have to take a developmental perspective. Anxiety and depression looks very differently at different ages, or can. Okay, even babies get anxious, right? But that's going to look really different than a 16-year-old that's anxious. You know, a baby's going to be irritable, fussy, unconsolable, that kind of thing. Teenager's going to have all that, and then maybe some other things too. Okay, so you always got to put these things in developmental perspective. So we'll pick on depression, but it's also true for anxiety. On the left are some of the common symptoms of depression, for example. Mood changes, diminished interest, change in appetite, sleep, all those sorts of things. But how do they really look? And again, putting things in a developmental perspective. So depressed, irritable mood. A child is acting out. You know, if you're in the schools, this is the child who's maybe getting in trouble before they weren't. You know, maybe they're more snappish, that kind of thing. It's not necessarily crying, it can be, but it can look much more anger, much more outward, okay? Losing interest in things. You know, they used to be big into sports and now they don't want to participate, that kind of thing. Change in sleep habits, they won't go to sleep, they sleep too much. Now, change in sleep is really important. We see a lot of parents that say their children sleep really well at night, and you talk to the kid and they're not, okay? Sometimes it's because of emotional factors like depression or anxiety. Sometimes it's the electronics. So we're always trying to tease out, you know, the child's up to 3 or 4 o'clock in the morning, chatting to their friends, watching YouTube, doing whatever they do online, that kind of thing. So that's always a good one for us to check into. Problems with concentration. Again, a really big thing that you may see. Again, if you're working with children in schools or out in the community somewhere, if they're really daydreamy and just forgetful and all that kind of thing, it could be a sign of depression or anxiety. It could be ADHD, but it could be something else totally. And that's agitation, fidgety, again, kind of that ADHD-ish kind of thing. Fatigue, child's always tired, lethargic, and certainly any thoughts of suicide or death. Those are our signs, or can be some of our signs. Now, depression, anxiety also, but depression is oftentimes mistaken for other things. My favorite is ADHD. Okay, I've seen a lot of kids with ADHD, but then when we finally take a really good look, it's something else. Sometimes that something else is anxiety or depression. Sometimes it's a learning disorder that wasn't picked up or something like that. I'm always suspicious of ADHD, oppositional defiant disorder, conduct disorder diagnoses when they come to see me or I see them out in the hospital. Because oftentimes what people see are the behavior, but they forget to ask what's driving the behavior. And I really hammer this home with my students all the time. You can't just see a child who's acting out and doing different things, because that could be a sign of something else, like depression. I mentioned a moment ago that despite what the Surgeon General said, that I felt like we've been in a mental health crisis for quite a while. And when you actually look at the data, you'll see that that's borne out. Oops. So pre-COVID data, you know, whatever you look at, the prevalence rates always run around 5% for anxiety and depression, other disorders. Depends on the studies that you look at, but they always run around 5%. Excuse me. And that's that's a good number. I mean, that's a lot of folks. That's considered quite a large number. So the data from this particular study from Journal of Pediatrics, had depression at around 3%. Good news was that about, according to this study, about 80% were receiving treatment. That's good. Anxiety, a little bit higher, but a little bit over half got treatment. Not so good. Same way with behavioral disorders, things like oppositional defiant, ADHD, that kind of thing. Running around 7%, but only about half or so. Oops. Come on. Why won't you do this? Huh. I apologize. I seem to have frozen. All right. See if we can pick it up from there. Again, looking at a different study, 2018 study, roughly, again, 5%, like I said, give or take, of folks diagnosed with anxiety and depressive disorders. Boys, slightly more than girls. Again, not everybody has access to treatment. Many times, children that present with anxiety or depressive disorders oftentimes have some sort of a comorbid diagnosis. So again, a lot of times they'll have some other diagnosable condition like ADHD or a learning disorder, that kind of thing. Oftentimes they may have a chronic health condition that puts them at higher risk. School problems, if you're depressed or anxious, it's very hard to concentrate on school. And again, parents experiencing a lot of anxiety and stress themselves. So again, it's kind of the chicken and the egg, which causes what? And a lot of times, again, as a co-occurring condition, a lot of times these kids aren't having different needs met. Again, they may be living in insecure settings, with food insecurity and that kind of thing. Maybe don't have good access to care of different sorts. Since at least the early 2000s, we've seen an upward trend, rates increasing, particularly for anxiety, not so much so for depression, which is nice. And how kids present tends to change with age. With younger kids, you tend to see much more behavioral issues, and then as they kind of move more through the tweens and adolescents, you'll see more and more of what we call the internalizing kind of problems like anxiety and depression. So it kind of changes a little bit over time in terms of the presentation. One of our most high-risk groups are kids with chronic illnesses. This is not an exhaustive list of co-occurring conditions. Again, we see this a lot of time in the hospital, particularly kids with chronic illnesses, things like diabetes, cancer, heart conditions, so on. Because that puts a lot of pressure on the family, for one. It puts a lot of pressure on the child. They miss out again on a lot of those normal childhood activities. COVID has had a big impact on our kids. Again, the Surgeon General's statement illustrates this. We've seen rates essentially double and more just with the onset of COVID. So those are really high numbers, 25%, 20% with anxiety symptoms, and even a moderate increase in more of those externalizing kind of problems, kids with more ADHD-ish kinds of conditions. And we're talking about children that are not infected with the virus. They're affected by the virus, right? Just by virtue of going through this pandemic. So in general, we're seeing a lot more, again, rates of anxiety, depression, sleep problems, PTSD, substance use disorders. Anecdotally here in the hospital, because my job is a consulting psychologist, so I work primarily on the medical floors with different medical conditions, we're seeing a lot of kids with eating disorders that are popping up. There's a lot of reasons for this. Certainly, kids are missing out on their opportunities, or missing out on school. And if you're a vulnerable child already, vulnerable by virtue of living in impoverished circumstances, or if you have a special need, you know, by virtue of not being able to go to school, you may be losing your resources. Okay, that's been a huge problem during the pandemic when kids were being schooled virtually, right? So our kids who were getting OT, PT, and speech at school, they were losing out on that. Kids that were relying on school breakfast and lunches were losing out on that. So again, our most vulnerable populations. Our teenagers have certainly experienced an increased difficulty above and beyond. Teenagers are always more vulnerable, again, developmental. We've seen a huge rise with suicide risk since the pandemic. I want to get to, yeah. So just in terms of ED visits, emergency department visits, because of suspected suicide, has seen a tremendous increase with the pandemic. Certainly much more so with our girls than with our boys, which is interesting. Don't know why that is. Certainly if you talk to our psychiatry colleagues that follow, that work down the ED, they will tell you we've seen a huge influx of kids with emotional behavioral issues, including suicide. Substance use, we've seen some increases in substance use during the pandemic. Interestingly enough, not the really bad ones that we think of. We're seeing much more nicotine, vaping increases. We're seeing misuse of prescription drugs. But the rates of marijuana and some of the other substances actually not so much. Same way with alcohol. And there are some factors that seem to predict who's going to be using substances more, and it's the more uncertainty a child is during COVID, the more likely they are to use substances to kind of treat some of that anxiety. And certainly if they have parents or caregivers that tend to use alcohol or drugs as a way of coping. Again, our more underprivileged youth or have been shown to be disproportionately affected by COVID, and certainly for all the reasons we just talked about, you know, lack of loss of resources that they might have been getting, that kind of thing. So there are many risk factors of why our kids are, you know, experiencing increased rates of anxiety and depression and other problems. And so there are some kids that are considered much more vulnerable. Typically, any child that was vulnerable before the pandemic, they've been disproportionately affected. So again, our kids that are living in more impoverished environments, you know, our LGBTQ population, because they're losing their supports, immigrant households, everybody. So now, if you had COVID, if a child had COVID, they are at increased risk by virtue of that. We're learning more and more that there are some neurocognitive and neuropsychiatric effects of COVID, particularly post-acute. So some of the more common things are increased rates of anxiety, depression, fatigue, pain, a lot of vague pain complaints, but also some cognitive issues that can again affect performance at school and other issues, and then it brings on more anxiety. Well, you know, it's kind of a dog chasing its tail after a while. So this executive syndrome really gets down to problems with attention, problems with impulse control, problems with behavioral control, all that kind of good stuff. The effects of COVID from a cognitive and behavioral standpoint, it actually can mimic what you see with concussion. Okay, so if you've ever worked with a child with concussion, you know that they need periods of cognitive rest, for example, because they fatigue much more easily. They have a harder time focusing. They have a harder time managing their emotions and so forth. Well, that was all the doom and gloom. Okay. So to summarize that, yes, our kids are experiencing much more difficulty with the pandemic. Certainly they were experiencing problems before, and it's just been exacerbated. Now, there's a lot of protective factors. You know, a lot of kids have done quite well during the pandemic. And the protective factors are not unusual. It's things like having stability in your life, certainly home stability, having those adults in your life, caregivers, including teachers and coaches and clergy and everybody. You know, that it takes a village, right? So having those kind of stable relationships really goes a long way to help as a protective factor. How parents and caregivers and the adults in a child's life are coping with the pandemic, but coping with life in general also is huge. And it's a huge protective factor because we are teaching our kids how to deal with adversity. So we don't want to protect, we don't wrap our kids in bubble plastic, right? We don't bubble wrap, you know, they need to fall down. They need to skin their knees. They need to fail, that kind of thing. But they also need to learn how to cope and manage those feelings. They learn that from us. That's why I've been so concerned about how some adults have responded to the pandemic very vocally on TV and all that. Because what do we want our children to see? What do we want them to learn? Again, and this is where you as art therapists really come into play, really helping kids make connections, really teaching them ways of expression. And Amy will go into that in much more detail. From traditional treatment, there are good traditional treatments for our kids who are experiencing anxiety and depression. We have good psychotherapies. There actually are some medications that are quite helpful for kids. But we got a lot of barriers to treatment. And again, this is where you guys become so important. Our kids don't get access to mental health care at the rates that they should. They just don't. And if you live in one of those high-risk categories, your odds of getting help are greatly reduced. In Alabama, we're at the bottom. Sweet home Alabama. We're at the bottom. So we're 51st in the nation, the 51st state, not state, it's District of Columbia is what they're talking about. In terms of the number of mental health workforce availability. This is all the mental health professionals that are available in the state of Alabama. That's psychologists, psychiatrists, counselors of different types, social workers. We are 51st. Go us. 920 patients to one provider. That's just not sustainable. That means we scratch the surface. We are 46th in the nation in terms of the number of kids with private insurance, in which their insurance does not cover mental health care. So much for, health equity. We are 43rd in the nation in terms of youth with a major depressive disorder that did not receive services. You got a major depression, you are going to be impacted severely, and the risk of suicide is high. And we're also 51st in the nation in terms of kids who, if they were evaluated, might meet criteria for an emotional disturbance, and therefore they're not getting IEPs, so they're not getting well served in school. So we got a lot of issues ahead of us. And on that happy note, I'm going to turn it over to Amy.
Thank you, Dr. Marullo. So, yes, I'm thrilled to be here, and I'm thrilled to be a part of this. But as Dr. Marullo pointed out, we have a lot of challenges. And art therapists can come in alongside other providers, alongside families and people who are wanting to do something different. So art therapy can be super helpful, but it's also something that's very different. And I think for a lot of people who are greatly impacted by both a mental health challenge and maybe exponentially by COVID, coming in and doing something different can be really helpful. For a lot of our kids, they're in the system, they have been a part of the system, And in many ways, the system has failed them. We just looked at the numbers for Alabama, and we are greatly lacking. And so I think that's one of the areas that art therapy can really bridge those gaps, because we are providing something different, and we are coming in to say, I hear you, I see you, I understand that you have tried all of these different things, and maybe they weren't as helpful as you hoped. There are great treatments out there, but they work as well as they can. And when they don't work, we find something different. So we start by meeting our patients where they are. That is both in the hospital, that is in the school, that is in our families. We start where they are, and we offer them honest, developmentally appropriate explanations for what's going on. And I think in so many ways, that's a part of what Dr. Marullo was talking about, is that we can understand all of these great things about depression. We can understand all of these great things about anxiety, or what has happened with COVID, or how we as adults or parents or caregivers should be taking care of ourselves. But to explain that to a kid, we can talk way over their head, and it is pointless. We are just blowing smoke or wasting our words. But if we instead change our phrasing and we start where they are, physically, emotionally, spiritually, developmentally, we start where they are, we can have much better outcomes. So in some situations, we might remind a kid that they can do hard things. In some situations, for maybe an older adolescent, we might talk about obstacles and how they're going to overcome those obstacles and what that can look like. But we tell them the truth, and we do that in an appropriate way. One of the things that Dr. Marullo talked about or alluded to was the fact that art therapy can offer self-expression. And I think that is one of our biggest benefits as art therapists, is that we are allowing people to express who they are, what they are, where they are, what's going on, instead of feeling that they have to fit into a box. Tell me about where you are. I'm here to listen to you. And that's what we do generally, globally, as therapists, as Dr. Marullo do as a psychologist. We come in and we listen to people with where they are. But I think with the pandemic, that has pushed so many people into a bubble, and now we're having to find different ways to express ourselves without going into an office, without going into a support group. So it's so much more nuclear, and we're being pushed to do that. So doing art therapy in lots of different ways can allow us to still express ourselves while being at home and maybe separate from people the way that we wish to be. If you will go to the next slide, Dr. Marullo. So one of the things with art therapy, and one of the things that we're going to talk about, is those protective factors, building that resilience. And so one of the things that can be super helpful is allowing people to, as Dr. Marullo said, fall down, scrape their knee, have those bumps and bruises along the way. From an art perspective, what that can look like is allowing people to make mistakes. And that's a hard one. So many people, statistics would tell us that 40% of people have had a shameful experience related to art before the fourth grade. That's a lot. And so allowing people to make mistakes in art can be both incredibly rewarding, but also incredibly difficult. So we can do that by offering people gradual materials with an opportunity to make mistakes. So for instance, we might start with a dry erase marker and a dry erase board. It's a whole lot easier to make a mistake on a dry erase board with a dry erase marker and to erase it with your hand, an eraser, a washcloth, a towel, whatever, and start again. But then we might move from there to a pencil with an eraser. So we can erase the pencil. It still might leave a mark, but it's a little bit more difficult to make a mistake with a pencil than, say, with a dry erase marker. Then from there, we can go to things like paint or crayons or pens or pencils or markers, things that would be much harder to erase, but allows us, from an artistic perspective, to practice making those mistakes, to practice getting something wrong, possibly starting over again, maybe problem solving. And that's a great opportunity for people to try something different in a very safe way. It's a whole lot easier to make a mistake on paper or on a canvas than it is in life. And so if we practice, if we allow our kids that we care about, our patients, our students, to make mistakes in a safe way, then they can gradually get to the place where they're doing that in life. Another option that we might have is to go into sort of a motivational interviewing type of drawing, and to do something where we're looking at what are some obstacles in your way. We can ask someone to draw a road, and then we can add some other things around that. And then also, what's an obstacle in that path? And how do we deal with that? Not you in life, but you in this paper. While you're on this road in this particular drawing, does the weather make an impact? Does what's on the side of the road make an impact? Was there something that fell across the road, like a tree? And what we often will see, as Dr. Marullo so eloquently talked about, is people in impoverished situations or at higher risk or more vulnerable, we're going to see more obstacles in their path. We are going to see that very clearly in their artwork. And many times, for a lot of our kids, they've been in the system for a long time, and unfortunately, they have had a lot of experience dealing with obstacles. And so they might not know what they're called, they might not know the terms for it, but we have 4-year-olds that are well aware of what that is and what that looks like. But then also, sometimes they're aware of how to deal with it. Generally, when they come to us, they're needing to find new or different, better ways to deal with those obstacles. But one of the great opportunities that we can give is to allow them to practice problem solving in a safe, very tangible way. Another option that we can look at is a Zen Tangle. So make a big scribble and fill that in gradually, one space at a time. So that can be as simple or as complex as that person needs for it to be. And so we can start by filling it in just with color, one space at a time, as blue, as green, as purple, or we can start to add patterns. What the statistics would tell us is the more patterns we add, the more it decreases our anxiety. So what that can do is it can build for our kids an opportunity to become more self-aware. So they can begin to recognize for themselves if they are mildly anxious. Okay, let's do color. That's great. It's going to help us decrease our anxiety. If we're moderately anxious, then maybe let's do some pattern, some color. If we're significantly anxious, then you know what? Let's go with all pattern, because that is going to be a great way to decrease our anxiety, just in a very tangible way. The nice thing about all three of those is that generally those are things that we might have at home or at school. They don't take a lot of special or expensive materials, but those are things that our kiddos can do to help themselves, and for us to offer them as an opportunity to practice, again, in that safe place from somebody who's with them in a very genuine place, to really be there with them and to help them practice those things. So let's see. I was going to tell some stories, but I'll try to save some room for questions at the end. If not, I'll come back to stories about some of the artwork here. Let's see. I think I have one more slide. So one of the wonderful opportunities with art therapy is to be messy. Life is messy. We all know that as adults. Life is complex and hard and challenging. But also our kids need an opportunity, as Dr. Marullo said, to see us model dealing with the messiness. And so we can do that from an artistic perspective and allow them to see us do that. Allow a kiddo to see us get paint on our hand and it be okay. Allow them to see us make a mistake and go, you know what? That person did not turn out the way I was hoping. It kind of looks more like a tree than a person. Ugh. Okay, let me see if I can figure this out. allow our kiddos to see and experience what it's like in a safe place with someone who can model for them. How do we deal with the messiness of life? Generally speaking, I think for many creative people, we are more willing, more able to sit in messiness because that's part of the artistic process. Generally speaking, an art studio, certainly mine, is not the cleanest place. It is very messy. And for me, that's okay, because I know that is part of the artistic process. And for many of us who are creative, we know that. We know that if it's gardening, we know that our creative gardening is going to get messy and we're going to get dirt all over our hands. And that is an okay thing. For someone who is, say, an attorney or a banker, that messiness might be a lot more difficult. And so practicing the messiness and that being okay in whatever way feels comfortable, be it cooking in the kitchen and trying a new recipe, or letting a child help you stir the cookie dough and make a giant mess with the flour. Okay, we can practice that. And so allowing that messiness is one of the wonderful ways that we can assist someone in building that resilience. So I will leave it there for now, and I will open it up to questions. And if there are not any, then I can certainly tell stories.
Thank you so much, Amy and Dr. Marullo. Wow, definitely, some things that are familiar to me and probably many, but also a lot of stuff that that I haven't thought about. And so we do have one question currently, and it's from James Jones, who's the head athletic trainer with the UAB Orthopedic Surgery Department. He says he coordinates the sports medicine program for Birmingham City School Athletics Department. He's had many conversations with coaches concerning mental and emotional health for young student athletes that carry a load of mental stress from all sorts of life situations, trying to learn more about how we can diagnose and treat mental health conditions and if this can improve sports performance. Is there a reasonable way to add mental health evaluations to mass athletic physicals? And he says, thanks for the webinar. So any thoughts about a way to integrate mental health evaluations into physicals?
Yeah, that's an interesting question. I think off the top of my head, yeah, I think there is a way of doing that. I mean, it's mental health screening is becoming more and more common just in primary care. Anyway, and I'm sure many of you have been to your own primary care doctor, you know that you're getting mental health screened quite often. So there are some ways of doing that. I think one of the issues that you want to think through is if you get a hit, what are you going to do then? So maybe making some connections with the local mental health resources, so that if you do pop up with a positive suicide screen or something along those lines, you've got a pathway, right? In terms of can treating mental health issues make you a better athlete, the answer is yeah. I mean, mental anxiety, depression, ADHD, all the rest. I mean, they're disorders just like having diabetes, and it does affect you. And it can affect you physically and performance and all that. So it's just a good thing to do. I mean, you wouldn't want your diabetes to go untreated. You wouldn't want a child's depression to go untreated.
Well, and I would add to that, I think, I agree, it is a very good question. And I think it's something that we can continue to raise awareness by asking those questions and just being willing to listen to the answers. But I wouldn't say if you get a hit, but when you will get a hit, because you will have someone who pops positive, not maybe for a substance, but certainly for increased depression, suicidality. It will happen because it is very, very common. And we know that we have lots of kids in every walk of life that are dealing with these things.
Yeah, absolutely. Again, you're going to want to think through what do you do and who do you go to, particularly given, again, our data, there are so few mental health providers. So you're going to have some sort of a way of managing that. Something to think about.
And I just want to ask an additional question to both of you, kind of piggybacking off of that, is do you think do you think that talking about this more in schools, just having open conversations about it and encouraging kids to seek support maybe from, school counselors or, for schools that do have mental health counselors and other resources. Do you think that would be helpful for, bringing it more to the forefront or just your thoughts about that?
People are very afraid to talk about mental health issues in general. They're really afraid to talk about suicide.
Mm-hmm.
And that actually sends a message that it's not okay to talk about. Mm-hmm. So, I think having conversations, general conversations, is just part of what a school does or what people do is good in helping parents understand that it's okay to talk. If they see something that is a concern to them, particularly if they're concerned about suicide, they should say the words. Mm-hmm. You are not going to put a thought into a child's mind. That's one of the concerns. If I say the word suicide, it's going to put that thought into their mind and they're going to act on that thought. Mm. They're not. Kids are pretty quickly, in my work in the hospital, when I do suicide screenings, and I do them all the time, teenagers are pretty quick to tell you, no, I'm not thinking that. They're fine. Mm-hmm. They're also pretty good about telling you, yeah, I am thinking about it. And as Amy alluded to, it's more common than you think. So yes, opening up the conversation, but making it okay, because there is still a lot of stigma associated with mental health diagnoses, and particularly suicide. And that just makes people high, and then they don't get the help that they need.
And I think Dr. Marullo is right. People are responding out of fear. And I think when we respond as adults out of fear, then we are sending that message that it's not okay. But if we begin to open up conversations and just say, I don't have the answers, or I don't know what to do, but I'm happy to be with you through this and to help you find somebody that can help. Yeah,
the other thing, piggybacking on Amy, is that there's lots of good teaching opportunities. And I use the word teaching broadly because I've spoken to parents about this as well. There's plenty of news stories about celebrities maybe who have mental health issues, or somebody had committed suicide, or there's certainly a lot of movies and shows where that is featured. And those are great opportunities to bring up the topic and talk about it in an open way. And where you don't have to focus on this one particular child who you're concerned about, So I always advocate looking for the natural teaching moments and using those as a way of engaging kids and letting them know it's okay to talk about these things.
Thank you. We got a couple more questions. Trish Coughlin says, in Alabama and across the U.S., how has the legislative changes made to transgender kids had an impact or will have an impact on mental health in those children?
It's going to have a bad impact. Our LGBTQ community is a highly vulnerable community, for one. Kids that fall into those categories are at higher risk already for bullying, anxiety, depression, and higher rates of suicide. It's hard to talk about this. any vulnerable child needs the opportunity to express their concerns, their fears, and learn how to be who they are. This type of legislation sends a message that you're not okay. And I don't have any data because it's too early, but it really raises some concerns for me for this group.
And I agree 100%. And I can say at Children's, we are prepared to take care of our kiddos in whatever need they may have. And we know that there will be an impact, and it will likely be a negative one. So we are prepared for that in a variety of different settings throughout the children's organization, because no matter how a child comes to us, be it from a primary care clinic or an orthopedic clinic or the ED, we are prepared to take care of them in whatever needs they may have.
Thank you.
Can I just add something real quick to that, which is, what about from the practitioner side, the doctors, the social workers, this group, as far as in trying to treat or counsel or work with them on that? I think that is probably equally as challenging or will be detrimental, at least something to be considered here.
Yeah, it certainly is going to impact folks that more on the healthcare side. You know, my understanding from the legislation is that as mental health providers, we're still protected in terms of confidentiality laws and that sort of thing. We can do therapy, we can have those therapeutic conversations, and we're not required per this legislation to break those confidences as our medical colleagues would be. Or teachers and other folks. So at least for mental health, there's something. But yeah, no, it's I know some of the folks that work with this population. They're tough people and they're strong advocates. But yeah, they need a lot of support.
Thank you. And then our last question is just follow up from James. Thank you for the great responses. Are there resources available to begin these conversations, or do you all do professional? So this is from the athletics kind of school system, or do you all do professional development for coaches and parents to assist in approaching these issues?
Oh, go ahead.
Do you want to go?
No, go ahead.
I think one of the best resources that's just very global and broad reaching is the PERC, our Psychiatric Intake Response Center. They have a list of, I believe it's about 1,800 different providers throughout the state. So if someone has a concern, if you are beginning those conversations with your athletes and there is a concern, hopefully we can get them to a provider that is close to them and is convenient for them. So it's just one number. It's 205-638-PIRC, excuse me.
7472.
Right, yeah. And they can help walk anybody through that.
Yeah, not only that, but you know, folks like us are always happy to talk to groups, you know, do talks, do workshops. My boss isn't always happy when I volunteer to do things like that, but I don't care. So that's just a joke. She's fine. You know, so certainly reaching out to your mental health practitioners if you want that kind of information. You know, people like us are always happy to talk.
Thank you. Thank you so much. And Dana's put in the number for the PIRC and a link to the website. But thank you both so much. This is such an important topic, and and of course we could be here for hours. And so I really appreciate both of you, and you know, maybe we can have another conversation about this and continue this. But I'd also like to thank everybody who was here. Our next virtual mental health Monday, I think actually would be a nice follow-up. It's the art of compassionate listening, because we need that in the world. So anyway, Elizabeth Vanderkamp, who's one of our artists in residence, is a certified in compassionate listening as a facilitator. So please join us on June 13th. And again, Amy Brown and Dr. Dan Marullo, thank you so much for being here and for what you do to support our children. So thank you.